Hello, everyone. I'm Rose Gerber. I'm the Director of Patient Advocacy and Education for the Community Oncology Alliance. For those of you who are our regular participants, and for those of you who may be joining us for the first time, just a little refresher about the intent of this advocacy chat. We provide you education resources on topical national policy and advocacy issues. Occasionally, we will focus on a specific type of cancer. And because this month is National Pancreatic Cancer Awareness Month, we felt that it was a great opportunity to bring in an expert on this topic. We all know, especially for those of us who are either cancer survivors, family members, people who work in oncology, anytime anyone gets a cancer diagnosis, it's very scary. It's very upsetting. Your whole world gets turned upside down. But I also feel that there is a deep understanding that pancreatic cancer seems to really be the type of cancer that creates the most fear, a tremendous sense of dread and unease. And though it's hard to say those words out loud, we know that that happens because, unfortunately, pancreatic cancer does have a very low survival rate when we compare it to other cancers. But what we're going to learn today is we're going to find out why this is. Why is it always such a poor survival rate? What we can do, as just individuals who may face this disease ourselves, as advocates. We're going to learn about what resources are out there. And most importantly, we're also going to hear stories, just highlights, because this is a shorter type of talk, about some inspirational stories and resources that are available to all of us. So it's now my pleasure to introduce our guest, Cindy Gavin, who is the founding director of Let's Win Pancreatic Cancer. And Cindy, it's my pleasure to have you with us, and let's hear your knowledge on this topic. Thank you.
Great. Thank you for all you do in the community and for inviting me to be with you today. As you shared, it's Pancreatic Cancer Awareness Month. And while pancreatic cancer, we're going to talk about the statistics, impacts 64,000 people a year, which is much less than cancers like breast cancer or colon or prostate. It is sadly on the rise to be the second leading cause of death in the United States in the next couple of years. So it's critical that we raise awareness about the risks and the symptoms, and also educate the population about what you can do if you're newly diagnosed. So maybe we can get started by talking about some of the statistics. So like I shared, roughly 64,000 people a year in the United States will be diagnosed with pancreatic cancer. On average, the occurrence is about 13%, but in the Black community, the rate is slightly higher at nearly 16%. While the rate of occurrence in the Hispanic population is slightly lower, there is a higher risk due to diabetes too. There is a link between new onset diabetes, especially when there is unexpected weight loss, and pancreas cancer. So it's one of those symptoms that people should be knowledgeable about, the connection between diabetes, new onset diabetes, and pancreas cancer. The survival rate is a mere 12%, and that's a terrible statistic. The good news is that there's so much science happening that the survival rate in the past 5 to 7 years has gone from 5% to 12%, which is in the cancer space a really big leap. And I have great hope that with all the science happening today, that we will see that number continue to improve. I'm just going to share one thing. When we launched Let's Win back in 2016, we launched at the AACR, the American Association of Cancer Research. There's a special meeting for pancreas cancer. And when we launched, there were 200 medical professionals in the room. Last year, I had the opportunity to go back to talk about the updates to the platform that we provide. And there were over 700 medical professionals in the room. So 3 times the amount of brilliant minds focused on this important problem. So let's talk about why the survival rate is so low. The pancreas is located deep in the body, and it's sort of a hidden organ, which is really hard to see and certainly to feel. actually, many people don't even know what the pancreas does until it's a problem. The symptoms are common to other symptoms, and we're going to talk a little bit more about symptoms, but the symptoms that appear may be reason for many other common things that happen in day-to-day life. Because of that, most people are diagnosed at a later stage. And like any other cancer, really the only way to cure the disease is to remove the tumor. And unfortunately, because of the late diagnosis, only about 20% of people are actually eligible for operation, which is called the Whipple procedure. And lastly, and I talk about this all the time because people ask me, like, what's going to change the game? There's no formal screening for pancreatic cancer. So early detection is key to any disease diagnosis and catching it early for better outcomes. So just to put it in perspective, when we think about, I know in my lifetime, when I think about the progress that's been made in breast or colon cancer or prostate cancer, there are standard of care screenings that happen. People go for mammography, typically annually is recommended, although it's changing. A colonoscopy every couple of years, and the PSA is a simple blood test for prostate cancer. That really helps with early detection and managing the disease.
Cindy, really good introduction overall. So, we've seen 2 slides already. In your first slide, you talked about the very bad statistics, particularly for African Americans. And of course, health equity is a very important topic to COA, to the Community Oncology Alliance, as well as to many of our peers in the national oncology space. So why is that? Why is it, it's bad overall, but why in particular with the African American and also the Hispanic population?
So sadly, it's unclear at this point why there's a higher elevation. But one of the things that is known, and we're going to talk a little bit about this today, are some of the reasons that lead to pancreas cancer. So some of the risk factors are lifestyle and behavior. So things like smoking or obesity, health-related things that you have in your control definitely play a factor. Heavy drinking is also one of the factors, behavioral factors, that weighs into the risks of developing pancreas cancer. The other piece of this is hereditary. So some of this is based off hereditary factors that are a risk factor, and we spend a lot of time educating those at higher risk, not only about behavioral risks, but about those that may have inherited a genetic disposition to the disease. So like I said, and this is just general to the population. Smoking puts people at higher risk. Obesity and heavy alcohol is definitely a factor when diagnosed with pancreatic cancer.
Cindy, I'm asking this because I'm asking on behalf of the audience. So with smoking, it's very clear. People know any type of smoking. The BMI is very clear. How do the medical professionals or within the pancreatic, or what is defined as heavy alcoholic consumption? Do you know what that is? Is it like drinking a glass of wine every night? Is it,
I think there's, in general, I think with all cancers, there's general guidelines. I think it's more than 3 to 5 drinks for a woman and 7 per week. I think that those are general, and I think that these relate to all cancers, but there seems to be a direct link between heavy alcohol consumption and pancreas cancer.
Thank you.
So let's talk a little bit about hereditary risks. Well, actually, let's go back to the next slide. Thank you, Nick. Some of the things that we can't control, one of the reasons I think why we're also seeing an increase, or we're hearing more about pancreas cancer, people are living longer. And, like anything else, we're seeing more diseases as people have a longer longer life, which is a great thing. But the numbers are definitely have increased over the years relative to other cancers. The average age of someone with pancreas cancer is roughly 70. So also at an older age, diabetes is a factor, pancreatitis, especially chronic pancreatitis, and then also pancreatic cysts, and certain cysts have more potential of developing into cancer. There are also other factors, which are the inherited mutations. And the most common ones that people hear about are BRCA1 or 2. People often call it the BRCA mutation. And when people hear about the BRCA mutation, they often think of breast cancer.
Absolutely.
They think of breast cancer. Those that are maybe more educated about the BRCA mutation know that it has a direct link to ovarian cancer, but it also elevates the risk of both prostate and pancreatic cancer. And roughly 10% of known pancreatic cancer at this time is a result of hereditary risk and mutations, which is significant. We received a question actually earlier about the risks and what you can do if you have a family member that had pancreatic cancer. And currently, there are screening programs for those at higher risk. So anyone that has a first-degree relative that has lost a life to pancreatic cancer, has a known genetic mutation of BRCA1, 2, or PALB2, there are screening tests that include annual endoscopies, that include ultrasounds, and there's also blood tests that are in the works that we're going to talk about that are really important factors in starting to get early detection on the disease.
Cindy, I wanted to ask something that I'm pretty sure I'm not the only one thinking about. So on the one hand, there's not good surveillance, but then if you're known to have a family member, there is surveillance. So why can't that surveillance for that group be applied to everyone? Help me understand that.
So because it's such a hard word. There are 64,000 people that get diagnosed a year, and because of all the false positives and the organ is also hidden, so it requires an ultrasound, it requires an endoscopy. These are pretty invasive, and so they're not standard of care at this time. They're really learning a lot from this population that's at higher risk in screening. The hope long term is that there are less invasive screening options, such as liquid biopsies and blood tests.
And it's uncomfortable, and I might be wrong on this, but I'm guessing too there might be payer issues as well, which is an unfortunate truth. The cost of some of these current tests. So
it's unfortunately the reality, but yes. But there are very, very active screening programs now for those at higher risk. So PROCEED is one that's now in 30 institutions throughout the country. And there are several others, and I would be, there's a study called Generate. I'd be happy to talk to anyone that wants to understand a little bit more about getting ahead of this, because like any cancer, knowledge is power, and knowing that you're at risk allows you to monitor and if the disease manifests, catch it early, which of course has better outcomes.
Thank you.
Maybe we could talk a little bit about some of the symptoms. So like I said earlier, some of the symptoms are really vague, like people have abdominal pain or back pain, a stomach ache after you eat, maybe nauseous, less appetite. Sometimes people are happy, they're not as hungry. These are very vague symptoms. So, no one would directly correlate them necessarily to pancreatic cancer. One of the things that we're doing is really educating the general, as a community, as a pancreatic cancer community. We're really have a big effort in educating GI doctors and general practitioners, so that, if this persists, that, it's a light goes off to say, well, maybe we should look further and see, if this could be something more serious. We don't want to pump fear into a
Right.
population with these
Yeah.
symptoms, but we do want to raise awareness.
Mhm.
Some of these that are more obvious and more concerning are unexplained weight loss, especially with new onset diabetes, dark urine, a light colored stool. We often hear about jaundice, which is yellowing of the skin. By the time someone is jaundiced, the disease is likely stage 4.
Mm.
So when we think about the timing of diagnosis, over 50% of people are diagnosed at a later stage, in stage 3, locally advanced, or 4, metastasized cancer. So because of that, unfortunately, only a small portion of people are eligible for surgery. Roughly about 20% of people are eligible for surgery. Do you have any other questions on that?
I do have a question from one of the earlier slides, and I'm thinking this might be one of those where the answer is in the words, but what the pancreatic cyst, I've never heard of anything like that. And how would someone know that they had a pancreatic cyst, or explain that piece to me? Seems relevant.
Yeah, so that's typically picked up in an ultrasound. Often, I think patients understand that they have a cyst when they have some of these other symptoms and they're looking for something else. Often they're benign, so they would be monitored by a doctor, but there are certain types of those cysts
Okay.
that could become problematic. We
So
could share some additional information on that.
So a scenario might be a patient who, or a person who's very self-aware, might possibly go into the physician. They describe one of these symptoms or multiple, and then they would get the ultrasound, you said, and that's where the cyst could be. Okay, I got it now. Yep.
Yeah. Do you want to talk a little bit about the resources that are available?
Yes. Oh, yes, let's go ahead and go to that, right?
So let's, people ask me all the time, well, what is Let's Win, and how do you help? So when a patient hears the words they have pancreas cancer, panic immediately sets in, and a patient and family are desperate for help. And Let's Win was born to create a vital resource for newly diagnosed patients. And so our 3 main goals, we actually are a publication. We publish new science-based information each week in both English and Spanish, and everything we publish is vetted by a medical professional. So we really help patients get, after a diagnosis, what do they do when they're newly diagnosed? How do they get the best treatment options? What should they be considering? People think of a clinical trial in most diseases as like a last resort. In pancreatic cancer, because we know that the outcomes of the 2 standard of care, really chemotherapy options, are not ideal and the survival rate is so low, we hope that patients will consider a trial on day 1. And that's a critical first step.
So Cindy, on the clinical trials, that's another very important topic to COA. And of course, because I'm very pro COA and pro CPAN, one of the questions, misconceptions that I've addressed many times over the last 12 years in my time with COA, and also as a cancer survivor myself, there's a misconception that clinical trials are not provided in the community setting. And the majority of clinical trials are in fact provided in the community setting. But we do recognize, as well as our oncologists recognize, that these rarer types of cancers might not be offered in the community. And in that case, the community oncologist will often refer to their academic partners. Is your understanding that when a patient comes in and is finally diagnosed, are they presented with a clinical trial option, or do you find that the patients are having to, start scouring the internet and try to find these themselves? What are you seeing in your role?
I think it's complicated. I think that patients are anxious to get treated immediately. And I think that the doctors are anxious to start treatment immediately. So that's certainly a factor in getting people, onto some treatment plan. I think that patients often do, sadly, have to advocate for themselves. But there's also more misunderstanding about clinical trials, just how to get to them, who pays for the clinical trials. Patients often think that they're getting a placebo and they're not going to be receiving any treatment, but all clinical trials include standard of care treatment.
Right.
So we try to really educate patients that even if you're enrolled in a trial and you don't get the new drug in the trial, you will always be getting the standard of care treatment. So I think it's really important for patients, and honestly, many people are treated in the community, and one of our roles is to respectfully educate those physicians that are not experts in pancreas cancer
Right.
around all of these options and the science that's happening in the community.
And I want to remind our listeners also that with these monthly advocacy chats, we've been doing them since 2020. We do have all of these chats, and we've had several on clinical trials are available on COA's YouTube page. So obviously that's not the topic for today. We're talking about clinical trials, but if you want more in depth, we do have that in our on our webpage. So please go and take a look. Thank you, Cindy.
Sure. So Let's Win is a wealth of resources on, the best treatment options, how to find those, also how to manage the disease. Because in order for patients, I mean, there's pain management, there's anxiety, there's nutrition, there's so many factors that feed into a diagnosis and getting the best treatment. So, I do encourage people to come to the site for more information and reach out if you have any questions.
I'm glad you mentioned the emotional support, the anxiety, because that's so important. Obviously, you're looking for important information, but I think every cancer survivor out there knows that when you first get a disease, you're going to the internet, and especially when you start reading the statistics, you get like paralyzed with fear, and it's got to be really heightened with pancreatic cancer. So, but your website also has great information on your survivors. So let's talk a little bit about genetic testing and molecular profiling. Let's talk about that.
Sure. So just quickly on the inspiration. I mean, we learned really on patients are panicked and families are devastated hearing those words, and we need to provide hope and inspiration. And we put it on our newly diagnosed page because we realize how important it is.
Yeah.
So we have shared over 200 patient stories that are all medically vetted in English and Spanish. But what I love most is that we have a monthly series and we have produced over 70 videos of long-term, so 5+ year survivors from survivors across the country. And those human connections about beating the odds and about learning about how other people have survived this disease are critical. There's also a wealth of information out there, support groups, Facebook groups online, private therapists, and just community support for those that can have walked in people's shoes.
Wonderful.
Like I said, clinical trials are first-line treatment, and it's really advancing the science. One of the things that's really important is that we get diversified patients to participate in trials because we're genetically not all the same. And one of the things that, I'm very mindful of, if we are just doing clinical trials on white male or females, in 10 years from now, we will not move the needles in other populations. So we desperately need the Black community, the Latino community to really, really be a part of this effort so that in 10 years, we understand how we can help more people. The other thing is, like I said, this is not a last resort for pancreas cancer. We really, really encourage patients to seek out trials early on in the disease. Sometimes the eligibility, a factor is what other treatments you've had and certainly how healthy a patient is, because it may require also travel. And so patients really should be as healthy as they can in light of this terrible diagnosis. to really be able to effectively participate in a trial. Do you have any other questions?
Not on that. I think just really quick, Cindy, the clinical trials, again, because our participants have learned a lot about this. That's a very huge patient frustration is sometimes the patients that need the clinical trials the most, that are the most desperate, are excluded. So there's a lot of other work on another advocacy front working on clinical trials to change some of those exclusionary factors so that more patients can get access to trials, because we know now that the numbers are still very low for clinical trial participants, about 5%. And I was on a trial 20 years ago, and those were the numbers then. So we haven't moved the needle very much there either. So I'm glad that you're talking about this to our audience. And then again, like you said, with the 200 professionals or however many you doubled at the AACR conference.
Yeah. Yes. I want to talk a little bit about genetic testing because that's really important. So genetic testing is now standard of care for pancreatic cancer. With 10% roughly of patients having a known genetic mutation. This is really important. It's really important for two reasons. We could advance the slide, please. It's really important for two reasons. One, it's important for the patient because if you have a known mutation, there are targeted therapies that can really help. And I always say, if there's a known mutation, there are more tools in the toolbox. For helping patients and getting better treatment options. So for the treatment plan, it's critical that we know if the patient has a genetic mutation or the tumor actually has any genomic mutation. The other thing that is really important is for the family. I know someone wrote in about, a family member that they had lost. Knowing that a family has a genetic mutation like a BRCA1, 2, or PALB2 mutation helps other family members know if they are at risk as well or potential risk. So it really does help not only the patient, but the entire family. Do you have any questions on that, Rose?
I just want to point out thank you for everyone that's participating on the chat. We also had a request for information. So Cindy's information will be provided on her closing slide.
I know we're running close to time, so if you could just advance the slide. Just want to make sure I covered everything. People ask about early detection. I mean, early detection is critical to advancing the treatment options and getting people diagnosed earlier with better outcomes. There's a lot underway. There's a long way to go, but they're working on less invasive biomarker testing, so blood tests for screening. And this is there's screening tests that are being used for all cancers to identify cancer-related DNA in people's bloodstream, and often they can detect that before they can even see a tumor. So early detection is moving along, and I am really hopeful that in the next 5 to 10 years, we're going to see significant advances here, and the result will be much earlier detection for pancreatic cancer and other rare cancers. So this is a key fact in just the result of better outcomes for patients.
So just mentioning the results of the genetic testing, and then your recent comment about what's available on your website with the survivors that are 5 years plus. That is the hope and inspiration that we wanted to share on this chat. So thank you for all the information that you have provided to us.
Great.
For our listeners, go ahead and tell them about your website.
Yes, sure. So as I shared, Let's Win publishes new science-based information each week. We really help amplify all the science that's happening in the community and provide in the research community, helping patients get to the best treatment options and to manage the disease. We're the only fully translated program in Spanish, and we've published the work of over 200 medical professionals from over 100 institutions. And it's just a wealth of information for both those newly diagnosed and those families at higher risk. So if anyone has any questions, please feel free to reach out to me. You could find Let's Win, pc.org online. We have a robust social media program to reach patients, and we're happy to help in any way possible.
Thank you, Cindy. I also want to give a special message to all of our participants. We hope that when you join these chats that you're gaining a lot of information and knowledge, but remember, we are all advocates. So this is a great opportunity for you to share this information with your friends and families, coworkers. Let them know that you participate in this chat. Let them know that, you know, CPAN has these video chats on our website, and hopefully we can all avoid this disease ourselves, and if not, then we can support others and be level-headed if it happens to us. But if we're emotional, that's okay too. We have one more slide before we say goodbye. Thank you again, Cindy, and to all our very committed listeners. It's hard to believe that we're going to be at the end of the year already. What an incredible year it's been. We are going to do something different this year. I'm going to have two of our guests who are nurses and also our CPAN chapter advocacy leaders. We do have chapters in cancer centers, community cancer practices across the United States. And during this chat, we're going to give you some highlights about a lot of the work that we do with CPAN. Our advocacy chats are just one piece of what we do, and you're a part of what we do. So thank you very much for always being here, and enjoy the rest of your day. Thank you.
Thank you. Thank you for having me.
You're welcome, Cindy.